My name is Dr. Neena Marupudi. I'm a pediatric neurosurgeon and chief of the Division of Pediatric Neurosurgery at Children's Hospital of Michigan. For me, I always look to find how can I make what is currently there better for anybody. It is so important not to be stagnant and not to just sit back and do what is always dictated to us or what is always in a textbook. It's important to look outside the box, push the limits, but push them safely and with quality. Damien is this incredible 14-year-old boy who came to me with a very complex, medically difficult to treat epilepsy condition called Lennox-Gastaut syndrome. I will never forget my very first meeting with them in our clinic appointment. I had met Damien. He was sitting in his chair, and about 10 minutes into the appointment, he had what we call a drop seizure, where his head fell down, and Jackie looked over at me and said, "Here, this is what the seizures look like."
Damien came to me. He was a child who was in foster care, and I agreed to take him as a replacement. I was a foster parent, first time foster parent. It was probably around 11 years old when he had a seizure that would not stop, maybe 10 or 11, and he was put into a coma by the doctors in order to help stop that seizure that went for about 3 days. And then they approached me about doing this type of surgery. They would have had to remove part of his skull. I didn't think his health would withstand a surgery, so I said no. Parents know when they have a child that's so ill. You don't know when you put them to bed at night if they're going to wake up the next morning. And that's what I lived with as a mom.
A few years ago, it had been recommended that he have a procedure where the two hemispheres of the brain would be disconnected, a procedure called a corpus callosotomy. By disconnecting the corpus callosum, we can reduce those seizures. At our facility, we have a device called the ROSA robot, which allows us to be able to do less invasive approaches for epilepsy and brain tumors. The trick here was, how do you disconnect the entire corpus callosum? Many surgeons up to this point were doing partial disconnections. Our goal for Damien, and to achieve his mother Jackie's goal, was to devise a plan where we could do a complete corpus callosotomy.
Dr. Marupudi, talked with me. She didn't speak to me. Whenever you give your child over to someone, because he can't talk, he can't tell me if he's hurting, you want to be able to trust that individual.
I sat with Jackie and I answered all of her questions, but I sometimes look back at my interaction with her and I think that she provided me with more reassurance. I shared with her, Jackie, I have this idea. I haven't done it before, but I know other surgeons that have done it, and I know the concept, and I have done something similar for other patients. And she said to me that she trusted me.
It was her care. It was her care that allowed me to know that he was in good hands. We will forever be grateful for how she's changed our lives. And, surgeons are brilliant. And my niece wants to be a surgeon. And I tell her about Dr. Marupudi.
I don't even know how words can express what kind of a change. It is a change that I didn't even expect. I learned that he wasn't having seizures anymore. While he has had a handful of seizures, this is not unusual, but certainly it has allowed his mother to breathe a little easier. He is trying to get up out of his chair and trying to walk, using less assistive devices in order to do that, and reaching for my hand and holding my hand and smiling and making these grand gestures of interaction. And to see this personality blossom and to see the person that he really is has been incredibly rewarding, and something I hope to see for other patients as well.
So this surgery has been life-changing for us.
When I walk into the hospital, I walk in with an attitude of, I will not compromise anybody's care. My goal is always to do what is right for the patient, for their family, and to be very open and honest with each person that I take care of, that is what I will achieve.